Hey guys, welcome back to We Met at Acme. I'm so excited to be here with Dr. Sarah Oreck. Hi.
Thank you. I'm thrilled to be here.
So tell us about, before we get into my first question that I ask all guests, tell us a little bit about what you specialize in.
Sure. So I'm a reproductive psychiatrist, but most people don't know what that means. And so I'm specialized in women's mental health. So, for the longest time, all of our medical research and medical information has really been based on studies on men. But we started to understand that hormones, especially during these really big changes in women's lives, an example is having a baby or perimenopause, actually impact mental health significantly to the point where in their reproductive lives, women have rates twice as high as men of depression and anxiety. So there was some kind of idea of, oh, there's something to this that's different from when, for example, you have an episode of depression. That's kind of different when you're pregnant or postpartum, for example. And so this is a relatively new field, but it's gaining traction, I think, as women are more and more tired of being gaslit, being misdiagnosed. So it's a very exciting field. And I'm the co-founder and CEO of Mavida Health, which is a startup really focused on providing this care for more people and more accessible. I was in a private practice before that was out of network and extremely expensive. So we're really trying to make this care virtual, comprehensive, and specialized in women's mental health and in network, because you should be able to pay for your mental health with insurance.
Yeah, that is a fact. And before we get into the deep, intense things that we're going to be discussing today, we'll keep it light with, what is your favorite romantic gesture? And this is more for, someone, a partner to do for you.
I think I love a date that gets planned.
Mm-hmm.
I plan so much. So I remember the days when my husband used to plan a little bit more, and I think that's really nice to just kind of say, oh, your Saturdays is taken, and not even know what's going to happen and just have it all happen for me.
Yeah. How did you and your husband meet?
On an app.
What was the opening line?
It was me. This was before those apps where like you could ask. It was actually on Hinge.
Yeah.
And the reason I chose it back then is because you had to know people. It was like Facebook friends. So I knew I was somehow.
Oh, that was that was the golden age.
That's the golden age.
Yeah.
Whereas like I feel too scared to date a stranger on Tinder that like I know at least here like someone can vouch for this person.
Totally.
And so that made me feel a lot more comfortable.
I love it. Okay, so getting right into it all, part of why you became a doctor, part of why you're launching this startup, part of, what spurred all of this was unfortunately a miscarriage that you had. There are a lot of questions that, people want to know how to show up for people who have miscarriages, this and that. But if you're comfortable, I would love to hear a little bit about your story.
Yes. I had been in this field way before even having children. So it was really interesting to come from the lens of having had so much of like containing different types of experiences. I'd been the container for people who struggle to conceive, for losses, both during pregnancy, but also stillborn, right? Like infant loss.
Yep.
I had seen all of it. And so I thought, I'm prepared for whatever comes my way. And that's just not the case. But I had 2 children and, they were healthy. There was no issues during my pregnancy. I was really fortunate in that way. And then we wanted a third, and I was kind of expecting things to go as it had gone. Like even though I had this experience of treating people and supporting people through these difficult times, I was like, this is not my reality. I was kind of like naive to it. And we got the NIPT test back, and it was bad news for us. It was really kind of a frightening situation, and yeah, it was a really hard time in the second trimester, and having a severe medical complication. And it was devastating, absolutely devastating. And I think I realized then, because I was between therapists, that I really wanted someone who was specialized. And even as an expert in the field, I had a hard time finding someone. So then my thought was, how can anyone do this? If like I literally do this for a living and it's hard for me, How can someone who can't afford out of network and wants to use their insurance, how can anyone get the specialized care?
Right.
And I think it's really important during this very nuanced time to have a therapist or a prescriber that really knows what's happening. Because when you don't, I see a lot of people bouncing in and out of therapy. I do want to say, a good therapist can have the empathy and hold space for whatever situation. They don't have to have lived experience. But for some reason during this transition, I really wanted some specialized care and I simply couldn't find it. And so at that point, I was already kind of thinking about Mavida Health, but it really made that like fire just burn of like, I have to do this. And it was in this situation that my co-founder, Emma Sugarman, actually in her past had a second trimester loss as well. And so there was so much support that I got from her. And I'm someone who typically like keeps this all to herself. I'm a therapist. I'm like used to kind of holding things for other people, but not necessarily opening myself up. And so to have her support was so life-changing and altering that I was like, oh, this is why we need a village.
Right.
And that's a little bit of what our app is about.
Mm-hmm. And then to back up a little bit into your experience, and for anyone listening who doesn't know what an NIPT test is and doesn't know when that happens. So that is a test. It's a screening test.
It's a screening test. It's a non-invasive test.
And it's around 19 or 20
No, it's
weeks?
around 10 weeks, actually.
Oh, it
10
is.
to 12 weeks. It's very early.
Okay.
It's the one that people kind of think about as you get the sex of the baby.
Right.
So
what am
people
I
are really
thinking of? I'm
excited.
thinking of the anatomy scan.
You're
at
thinking of
20.
an anatomy scan
Okay.
that happens at 20 weeks, and that's where you get an ultrasound that where you can see a lot of the different parts of the baby, and you want to make sure that things are kind of
Okay,
in
so
their right
NIPT,
place.
we're talking between 10 and 12 weeks. This
Yes.
test is taken.
And it's through your blood.
It's through your blood. So
Non-invasive.
just for context for listeners who know my story, I went through IVF, so I opted out of the NIPT test, but you can still do it
I actually
if you've
had
done
gone
IVF.
through IVF
Mm-hmm.
and I still had it.
Oh, interesting.
Is another thing.
That is crazy to me.
I think there is this, so we can back up and kind of talk.
Yeah. I want to hear about your IVF experience, but
Yes.
it's interesting because my OB was like, you should still take the test. And I was like, why? I already went through hell and back with IVF. I'm not doing it. And I guess there is obviously a chance. It's small, but there is a chance. And that unfortunately.
Because the testing that they do for embryos is really, and listen, even as a physician, I was like, my embryo is perfect. I got PGT testing. That means there's nothing wrong. But it's just, to get really technical, deletions and duplications of chromosomes. But chromosomes can do all sorts of different things that you don't catch there. And so this is where NIPT testing came in. But actually the predecessor of NIPT are things called chorionic villi sampling or amniocentesis, which are like, what people think is really scary tests that you do. CVS is earlier. It's like 11 to 14 weeks. And the amniocentesis is a little bit later, in around 14 to 16 weeks. And those actually test for the genetics of the baby, and they're diagnostic tests. But there is this sense of like, you'll be fine if you do PGT testing. And I also want to be clear, you don't have to get any of these tests, especially if you're not going to do anything with them.
Right.
If for you, having a baby that has any kind of chromosomes or abnormality is something that you will kind of figure out or your family is totally fine with, it's a different choice.
Right.
And
well,
so-
also,
yeah.
they're expensive tests.
They're expensive tests.
So if you can't afford
Right.
to get any of these tests done, but you want a baby very badly,
Yes.
That is also
Most of them
something,
will
a
be,
choice that people make. Yeah.
Most will be covered for women over 35, which
Mhm.
I was, because there tends to be a risk of more genetic abnormalities as we age.
I literally, I'm not kidding, thought that you were maybe 26.
Oh, well, thanks.
So whatever you're doing is working.
Thanks.
You're 35 now.
38.
Okay. Wow.
Yeah.
I mean, I don't see a wrinkle.
That's a little secret called Botox. I use a lot of it in LA.
I'm in on that secret for sure. But backing up, if you're comfortable,
Yes.
what is it that you discovered in the NIPT
A
test?
chromosomal abnormality that would basically make the life of the child that I would have a completely different experience. They had a very short life expectancy with a lot of medical problems, as well as neurological difficulties. So not only was this child going to have difficulties being verbal, communicating, doing any activities, but also was likely to not live for very long.
Right.
And I already had 2 children. And again, this is a very personal decision that can be very controversial.
Mm-hmm.
But I live in California where I had the right to choose, if that was something that I wanted for my life and for my family, and I chose not.
And I think that is completely valid. And if anyone were to judge that decision, I hope that they don't listen to my podcast.
But it's challenging, and I have to
Yes.
say, for anyone that says any kind of termination or abortion is like something you're just doing willy-nilly, like, it's not.
Oh my God, of course
Like,
not.
it
I mean,
was one of the most devastating and difficult decisions I've ever had to make.
yeah, I can't even imagine. And just out of curiosity, because I don't know your family, did you end up having another
I did.
child? Mm-hmm.
I did. I have a 3rd child who's 6 months old.
Mm-hmm. And you did IVF for that. Okay, so now backing up.
Yeah.
Why in the first place did you do IVF? And I am like an IVF preacher, so
I had very low AMH and low egg count. And actually, my mother, I should have known. My mother went through menopause at a very early age. It's actually what made me interested in this field generally. When I was like 10 or 12 and my mom was in her early 40s, like she was going through it. Hot flashes, all of the symptoms. So like from when I was a preteen, I knew what menopause was.
Right.
I knew exactly what the experience. It was extremely painful and difficult for my mother. But what I didn't realize at the time is that she was so young. She was in her early 40s. And again, at a time where no one was talking about it, right? I can just think back and wonder how isolated, how lonely that must have been, especially like not knowing exactly what's happening, being told, oh, you can't take hormones now, you should take hormones. There was
Right.
we can talk about the whole controversy of like everyone gets hormones and then one study comes out in some ways that was biased and then nobody got, and everyone had to stop taking hormones. But anyway, perimenopause is also something that interests me a lot. But anyway, so she dealt with that, and so I think I should have known in some ways that that was probably coming for me too.
But this low egg count,
Yes.
low AMH, I happen to have a fertility doctor who is amazing. She's like my best friend. And or I think she's my best friend. I don't know if she'd feel the same. But she doesn't really believe in the
Yeah.
AMH thing.
Yeah.
And so
And you can have high quality.
right. So
Right,
was
and I
there
did in the
was
past.
there a part of you that was like, let me at least try for a year and see if
Maybe it's
like how true it
impatience,
is?
maybe it
Mhm.
was kind of a lack of confidence in that, but I decided this is the route that I wanted to go with.
Yeah.
and kind of went with it. And in some ways, I got to experience something so many of my patients do as well. And so it's been a really big learning experience.
Right. Well, something that you mentioned, which I love, is that you wanted to, like, when you were needing the therapist that you became, you wanted to see someone who's had the lived experience. And that's like, we
Or
don't
at
talk
least
about
is, like,
that.
known.
No, but we
Right.
don't talk about that
Right.
enough. I remember, I've switched therapists. I have only once actually, but my first therapist, she was so sweet, but she would never like give me anything about her life. And
You
and
wanted some
I
self-disclosure.
just needed like a tiny bit of like knowing that, let's say that I was there because I wanted to find a man, that she had a man, like whatever it was, that's not what it was. It's not why I went to therapy way back when, but whatever. And now the therapist that I have, she has a son. I have a son. It sounds ridiculous, and it's not like she's telling me that much about her life. Of course it's about me, it's my
Yes.
session, but it's really comforting to know that she has something that she can actually relate to about me. And so that doesn't mean that like if a therapist is, just starting out, like there's, throw her to the side, she's no good. But there is something really special about someone having your exact experience. There's something, it's like intangible.
There is, and there's these different schools of thought around therapy and different types of therapy modalities. So you'll see with very traditional psychodynamic therapy, that's not the case. Self-disclosure, like if you asked me if I had kids, I would say, what do you imagine? What's your fantasy
Yeah.
of what I have?
Oh, I love your therapist voice.
And that can be oh, great. And that can be in some ways also instructive, but what you're saying is like that's not what you needed in the moment. You needed
Mhm.
someone to just be like, I get you. I'm not going to disclose all of the stuff that's happening for me, but like I hold you and I can contain you in that way. And I think in some ways that's how I've evolved. I did this before having kids, and I think it's really been different, and I've actually sometimes when it's appropriate have done self-disclosure because I do think it can be in some ways very therapeutic.
Oh,
When it's not
totally.
is when it's like
Mhm.
there's a lot of LA therapists that then it becomes like their session and I'm like, what's going
Totally.
on there?
No, I think it's definitely an art to know when to say,
And it's for the benefit of the patient in front of you,
exactly.
not for you.
Exactly. I love that. I'm gonna get into some of the questions that came in for you.
Love it.
How do you be a friend to someone who experienced a miscarriage? And so, how would you have liked your friends to show up for you in your situation, or how did they?
Well, I think what's hard is in some ways I was contributing to the problem by being so silent. Right? There's like a silence around this. There's a shame of like, what happened to my genetics? What did I do wrong? I thought I was doing IVF. Like this should have been totally fine. Um, and so that guilt, that shame, the wondering, should I not have done IVF? There's something, right? There's some risk to having an IVF child. Like, did I put myself at higher risk? What did I do? So I think there was a lot of blame and shame, and that kind of resulted in some silence. Um, but ultimately, when I did disclose it, I think my friend showed up in the way that I wanted and felt like curious about what my experience was. There wasn't a oh I had the same experience or this happened to me, which is really helpful. And I think once you have a loss and express that, everyone around you, it's like, oh, grandma also had a loss and my aunt did, and like
Mhm.
it's like, wait, why don't we talk about this more, that we all have this shared experience? But I think what's really important is I don't put my experience onto you.
Mhm.
I'm curious about it because we may have had a loss at the exact same time and have completely different reactions to it. And so I really appreciate, especially my co founder, Emma, who had a very similar experience almost at the same dates, a little bit later, but was very curious about how is it for you? This is what I experienced, but tell me about what you did. And
Mhm.
so it's about curiosity, but I think often if you haven't had the experience, you feel so intimidated by, am I going to say the right thing or say the wrong thing, that you end up not saying anything at all.
Mhm.
And that feels really lonely.
Yeah. I also have a friend who experienced a miscarriage after having 2 kids, so for her 3rd. And she was lucky like you, and she now has a 3rd. But I imagine that myself experiencing this because I'm just gonna be open about my thoughts, like, I'd be like, "I
Yeah.
I should have just been happy with 2.
Right.
What's
Oh,
wrong
that
with me?
happened.
I
That
had
happened.
2 healthy
Yeah.
kids. Why did I do this to," I would be blaming myself so
Oh,
much. I
100%.
would be, and I'm not saying it's okay to, like, I'm just explaining how I would react to it knowing myself, and I would say, maybe I don't deserve a 3rd, and I have no idea if you had any of these thoughts.
Oh,
But
100%.
let's say that you did. How did you talk yourself back into it and get through that?
I think even in the wording miscarry, right? It's like you miscarried something. So even from the semantics of it, I like to shift to pregnancy loss, right?
Mhm.
One feels like you actively did something versus the other is something that happened. This is a genetic abnormality that happened. I didn't do anything to it. It wasn't, I mean, I am older, but at one point I was like, I'm just old and my
No.
husband's old and we're all just like this is what happens when you wait too long to have children. But I think after processing it, I really stepped back. And luckily, because I'm fortunate enough to be in therapy, really thinking about what are my values and how am I going to align my behavior with my values. And my value was to grow my family.
Mhm.
And yes, I had anxiety. There was like, I was probably 38 weeks pregnant. I'm like, I'm not sure if I'm going to have a baby. Maybe I'm going to have a baby, maybe not. It was certainly a more anxious experience, but I ultimately knew that having that third child was something that was aligned with what I wanted.
Right.
And ultimately, I think in therapy, that should be a big kind of motivation or focus of like, how do you align what your actions are to what your values are?
Mhm.
And I'm so glad that all of these worries, guilt, shame, anxiety, I was able to work through because ultimately, this is what I wanted for my family.
Yeah. Yeah. And I'm so glad that you worked through that. And I'm sure
But there was a
you're,
time where I was like, maybe I don't have to do this
yeah,
anymore. And IVF is a lot.
it's a lot. And actually, I'll go to the IVF question just because you mentioned it. Somebody asked how to support a friend who has had an unsuccessful IVF transfer. And this comes up all the time. And I've had a friend, unfortunately, in this experience. And I just told her that I loved her. I sent her her favorite ice cream. And I kind of just waited for her to want to talk to me.
Yeah.
I have no idea if that was perfect. I don't think there's any such thing as perfect.
No. But you reached out and you acknowledged, like, I see you.
Yeah.
I know what's happening. This is like a nonverbal communication to you that I care for you, and leaving the door open to when you're ready, because some people aren't ready to talk right away. And they want time to themselves and to process this grief, which ultimately happens. But I think it's really hard because you do this thing that you think, you're paying for, you do so much work. How come it's not working? It's almost like this cannot fathom that it doesn't work, even though it doesn't work for so many.
Yeah. So just acknowledging.
And I always love curiosity. When in doubt,
be curious.
Just be curious.
I love that too. 4 weeks postpartum, feeling so alone and unsupported by my partner. Is this normal or is it a sign to divorce? It's so funny. So in sobriety, because I'm sober, they say don't make any changes within the first year of sobriety. That's literally how I feel about postpartum. Don't make any changes in the first year of postpartum.
I'd agree. Unless the situation's dangerous or it's
of course, or unless you're so sure that this is so never going to work.
But I agree. But I think what that's a reflection of is really a lot of cultural norms, the lack of distribution when it comes to that invisible load of the weight that, in heterosexual couples, women typically, and I'm making assumptions about who this person is, that she's married to a man. And I think that there's a lot there. And I think we've come a long way from different generations, like even the generation before us, in terms of men and their involvement. But I think there's still a huge amount that needs to happen. I also think people are having kids in isolation. And it's not an individual sport. It's something that we were really meant to do as a village, right? With extended family, and we move away from extended family. And so we don't have those support systems. And, paid childcare in this country is unaffordable to most.
Ridiculous.
And so I think being kind of the sole person in charge of that is such a huge burden. And so that is in the throes of what she's experiencing, which I think there is a hormonal component, there's a relationship component, but there's also like a societal component.
Yeah. Yeah. I mean, there's also it's like you create this child with this other person. And then sometimes you're like, this other person is now irrelevant to me. I have this child.
Right.
There's all kinds of feelings that you could feel postpartum. Somebody asked, what are some strategies to protect my maternal mental health while paternal mental health is also a challenge?
This is a tough one because we know that, fathers or non-birthing parents are also at risk for postpartum anxiety and depression. So I think it's if you do have some space to be able to check in with your partner, but ultimately you have to put that oxygen mask on yourself before anyone else. But I think that requires a lot of communication. And some of that communication is like, hey, you're just sitting there. I really need help.
Right. Yeah. You got to communicate. Going back to miscarriage for just a moment. How did you so somebody asked how to not hyper-focus on conceiving after a miscarriage. I think this is different for you and your experience. You had to focus on it. You have to go into an office, talk about IVF, when you're going to do the next transfer. If you are trying to get pregnant naturally, I hate the word naturally.
I know.
What else can we say?
Spontaneously. I know. It's not, it sounds very artificial,
oh my God, there's
but
so
I like
many
it
terms
more.
that need to be thrown in the garbage.
Same with natural labor.
Yeah, natural birth. Nothing unnatural about an epidural, ladies.
Nothing unnatural.
So natural conception, hate that. Natural birth, hate that. There's another term I hate, infertility. Hate
Oh,
that.
yeah.
How about just,
What do you like?
fertility?
Fertility struggles.
Fertility.
Yeah, yeah.
Yeah, it's a fertility struggle, not
Yeah.
an infertility struggle. I'm
Yeah.
not infertile. Thank you
Right.
very
Oh,
much.
yeah, that's such a there's
It's
something about
nasty.
that that's
It's
it's
nasty.
nasty.
Anyway, how do you not hyper focus on conceiving spontaneously
Yeah.
after you've miscarried?
I think that's like asking you to not think of a pink elephant, and that's
Yeah,
like the
you're
first
gonna
thing you're
focus
going
on
to,
it.
right? So it's a little bit of like when you're like, I need to get that thought away. You're throwing that tennis ball against that wall, and it's going to come
Mhm.
right back at you even
Yeah, like you're
faster.
gonna focus on it, and that's normal. And I think I hate, and I don't think you experienced this because you didn't do IVF because of fertility issues. But when we were trying to get pregnant, all we would hear is just relax, just relax. Your
And it'll
body
happen.
will just drop the things into place. Like, no, there's no correlation to relaxing and getting pregnant. So guess what? Hyper focus on it all you want, and that's okay. Like, allow yourself to hyper
I
focus.
think it's just like, or at least have the awareness of what's happening.
Mm-hmm.
And I think too much of our culture generally wants to run away from difficult, uncomfortable, right, feelings to like all happy and good. But that's not what life is.
Right.
And I think sometimes you can sit in the, oh man, I feel grief. I feel loss. I feel angry that everyone else just gets pregnant without thinking about it.
Mm,
And I don't. Or I was told my entire life that I could, right, just look at a man and get pregnant. And
right.
that's clearly not the case, especially
Mm-hmm.
once you're in your 30s.
Yeah.
So I think acknowledging that, getting like confronting those feelings is better than saying ignore it.
I agree. That's what my therapist would
Okay.
probably say too. Somebody asked how to cope with postpartum anxiety and depression with my baby without outside help to watch my baby to be able to go to a therapy appointment.
Oh, well, at Mavida Health, we believe in the BYOB, bring your
Mm-hmm.
own baby to therapy,
Mm-hmm.
because I think there's so much magic in actually seeing a parent with their baby and so much information that we can gain from that. So when your babies are nonverbal, I think it's appropriate and fine for them to be in therapy. It's like it's better for you to get it done. Even if you're walking around kind of bouncing that baby, that's okay. At least there's a little bit of time for you.
Oh, yeah. I've done therapy pushing the stroller.
Great. That's exactly right. I think
Yeah.
once kids get verbal or are walking, it becomes more difficult to
Right. Like,
manage.
I also had my AirPods in. Like, it wasn't on
Right,
speaker.
right, that too.
Uh-huh. Okay, we'll do two more. This one is about intrusive thoughts. Why are they so common in postpartum women?
Oh, I love this one. Your brain actually changes during pregnancy. And so we have, we've done MRIs, we've kind of started to track this, but unfortunately, this should have been done many, many years ago, but it's quite recent. But we've seen that those that are birthing parents, their amygdala actually grows significantly. And the amygdala, we can think about it as the kind of alarm system of the brain. And this is where the fight or flight instinct is. And actually, non-birthing parents also have an increase in their amygdala. It just isn't as significant. And ways that you see that it works is sometimes the mother or the birthing parent is like the only one that can hear the baby crying at night, but you can be at a house full of people and no one else hears the baby.
Yeah.
Like you are hyper vigilant towards that. And part of it is because it's biological. Our infants can't survive on their own like other mammals who are born and start walking. Like ours are not. That's why we call it the fourth trimester. And so in some ways it's very protective of your infant. And when you think about some of the most common intrusive thoughts, one of my most common and favorite, least favorite because I have stairs at my house, is that image of I'm carrying my baby and we both fall, or the baby falls out of my hands and rolls
I
down
think
the
we've
stairs.
all had that.
Exactly.
Mhm.
But in some ways, it's very frightening. But what is it biologically doing? I'm holding on to my baby a little bit tighter. I'm looking down at the steps to make sure that I don't slip. So in some ways, there's a protective factor. But and we all have intrusive thoughts all the time. We imagine, I don't know, someone being naked that you're like, oh, I never want to see that. But when we're not under stress, we're like, that was weird, and I'm just going to move on. But when we're under stress, it can become really jarring. And so what I see is that these intrusive thoughts, especially if they're new to you or unfamiliar, can be very frightening, because then the thought is, do I want to harm my baby, even though this seems really scary to me? And so how would I try to explain is like there's a biological underpinning, but it can get into a cycle and get stuck. And that's when we have what we call postpartum anxiety, but also postpartum OCD.
Mm-hmm. Yeah. Yeah, we talked about that a little bit we had an episode like dedicated to all types of
great.
OCD.
Fantastic.
And that was a crazy one. How to bounce back from feeling blue postpartum.
85% of people have what we call the baby blues, which is in that 2 week period after giving birth. There's like these hormone fluctuations that are all over the place. One minute you're like, oh my God, I'm so sad. And the next is this is the most joyful experience of my life. I think in some ways it's riding those waves and knowing that it will be over soon.
Yeah.
And if you're hopeful about what comes next, of like, I'm not getting any sleep, in a couple weeks, things are going to get better, you're probably going to be okay. When it starts to stick around and you're having less like hopefulness and more hopelessness is when we start to get concerned about postpartum depression.
It's so funny. I don't know if you ever watched Euphoria.
No, I haven't.
But there was this scene where Sydney Sweeney's character is like, I've never been happier. And she's like crying.
Yeah.
Like she's like clearly so sad.
That's exactly
how you feel postpartum.
That's the
like
feeling.
You've never been happier, but you've never been like more out of your mind. Okay, last question, and this one just goes back to miscarriage. How common is pregnancy after miscarriage? I think there's like a lot of people, I have some friends who've had miscarriages and have not been able to get pregnant since. So I think there is this concern, and I don't know if they're the exception, the rule, whatever it is.
I think it all depends. It depends on someone's age. The reason for that loss, I think, is really important. What we typically say is if pregnancy loss is actually quite common.
Mm-hmm.
And I like to say the more babies you have, the more likely you're going to experience one because, again, it happens quite frequently.
Right. It's like 1 in
4.
Oh, 1 in 4.
Yeah,
wow.
It's very, very common. And so what you find is that if there's at least like 2 or 3, most physicians are not going to investigate what's going on, and they're going to say you're probably going to go on to have a successful pregnancy. But, if you want to get the genetic testing, like make sure that everything is okay, that you're not a carrier for anything, those are some strategies to make. And, again, if you do want a family, there are ways to kind of achieve that. It may be through assisted reproductive technologies like IVF, but it also may be adoption, or it may be, maybe concluding your fertility journey. And I think we don't talk enough about that and what it's like to not conceive and then have the experience of like coming to terms with that grief and that loss and saying, right, maybe this is it. And for someone else, after they had this loss that I had, that might have been the right decision for them.
Right. Yeah. Yeah. I have a friend who is going the surrogacy route. I know that Selena Gomez, who's not my friend.
Yes.
But just
but
mentioned.
We wish were.
Yeah, but I wish. Just mentioned she's not going to be able to conceive.
I loved that.
Naturally.
Because
naturally.
Right,
again.
I know.
Spontaneously.
It's so, that she wouldn't be able to be the carrier.
To bear her
right,
own child.
To be her gestational carrier. And I think even that and saying that can be so, I think, helpful to people who are feeling that way and feeling so betrayed in some ways by their body. But to know that, this can happen to anyone, right? Someone who's rich, famous, right, popular, whatever you want, can also have this experience, I think is really meaningful and probably has helped a lot of people feel less shame.
Totally. Yeah. Awesome. This has been so much fun. Sarah, can you leave us with a quote or piece of advice, something that has helped you or your clients throughout the years, your patients?
Yeah, I think it's, especially when we talk about loss, that everyone's experience can be so varied, right? I have people who have losses and the next week they want to conceive. Or I have people who have losses and then they're done and they're grieving, and it's almost a loss, even if it's early, that's akin to losing a family member who's been alive. And I think in this range, and obviously there's everything in between, but what I have learned from it is that everyone reacts so differently, and it's really important to like not be judgmental. Oh, she just had a loss and she wants to have another baby. Like, yes, that's fine, right? That's how they're coping with it. And I think being more kind of cheerleading one another, even if it's not the choice you would make, I think is really important because everyone's perspective and sort of values are different.
Parenting in general.
Wouldn't that be helpful?
Yeah, not just...
Just wait until...
Right, not just Oh, the worst.
Mhm.
Not just for miscarriage,
For
but in
everything.
general.
Right.
Let's
It might not be the
yeah.
choice for you, but I think kind of being able to accept and get attuned to the fact that it might be the right choice for someone else, and how wonderful to be a friend who can support that.
Mhm. I love it. Where can everybody find you, follow you, and get involved with
Yes, with
your
Mavida Health.
with Mavida?
So my personal Instagram is at Sarah Oreck MD. You can find all sorts of stuff around women's mental health. We can also follow Mavida Health, which is my organization and clinic, which is operating clinical care in California, New York, and New Jersey. But we have educational content, group chats nationwide, and that's at mavidahealth.com. And our Instagram is at Mavida Health.
Awesome. Thank you so much.
Thank you. That was great.